So this is Nutrition During Pregnancy, Part 2. In Part 1, we finished off by looking at food groups, and now we will continue on by looking at calorie needs while pregnant with multiples. So looking at women who are carrying more than one baby, for women with a BMI of 18.5 to 24.9, which was a pre-pregnancy normal weight, about 40 to 45 calories per kilogram pre-pregnancy weight per day has been recommended for intake. There should be caution that adequate weight gain should be used as an indicator of sufficient energy intake. Now, for underweight women, the estimate is around 42 to 50 calories per kilogram pre-pregnancy weight per day. And for overweight women, it drops to around 30 to 35 calories per kilogram pre-pregnancy weight per day. Now, the DRIs state that beginning in the second trimester, sufficient energy intake, as well as an additional 50 grams of protein per day above the non-pregnant DRI for protein, is prudent for multiple pregnancies. And then to ensure that protein intake is adequate for women carrying multiple babies, macronutrient composition, percent kcal, may be optimal at 20% protein, 40% fat, and 40% carbohydrate. And again, emphasizing, just what we've been talking about before, whole grains, limiting saturated fats, and keeping half of your plate fruits and veggies. There are special situations to consider when working with underweight women. A poor prenatal diet can lead to low maternal storage of nutrient and insufficient micronutrients available for human milk. Malabsorption issues such as surgery, Crohn's disease, and other GI orders may have resulted in a lack of nutrients. And finally, if a woman has disordered eating, that can actually result in a low fat content in her milk and low levels of certain nutrients. So in that last situation, we'll talk about eating disorders later on in this module, but if a woman isn't already under the care of a healthcare team that specializes in disordered eating, a gentle referral may be necessary in order for this mom to really address the issues that she's facing and to assist her on the way to becoming fully healthy. So complications due to obesity during pregnancy include spontaneous miscarriage, birth defects. There may be limitations to the ultrasound and its readability and the ability of the technician in identifying other conditions and disorders. Gestational diabetes, as we've mentioned before, is a factor. There could be high blood pressure. A stillbirth can result from obesity, as well as other fetal growth anomalies. So other complications due to obesity during the labor and delivery phase, there might be difficulty in fetal monitoring. There might be a need for a cesarean delivery. There's also reports of decreased success of a vaginal birth after a C-section and difficulty in anesthesia as well. So a postpartum complication due to obesity could be postpartum hemorrhaging, wound infection, as well as obesity in their offspring. I realize I've spent quite a bit of time talking about overweight and obesity issues. I purposely did that because as a nation, we are facing an obesity epidemic. Upwards of 60% of our population is either overweight or obese. So you will be having prenatal clients that are struggling with overweight and obesity issues. Extra encouragement early on prenatally, it's really important. Studies are finding that obese women are 4 times more likely to not initiate breastfeeding, either because there's a birth complication or because they have short and or flat nipples due to the increased fat tissue. And also studies are finding that obese women are less likely to continue breastfeeding. Extra encouragement with those clients, helping them to know what to expect and really guiding them through those first few days of breastfeeding is really, really important. As well, babies of women who are overweight or obese, they tend to be larger babies, and those babies as well have less of a breastfeeding duration. It is really critical that these clients do receive some extra support and extra assistance in order to help them be successful in breastfeeding. So this is our first test your knowledge slide for this module, and I am going to read the question and then wait about 10 seconds before the answer pops up. So what are all of the possible consequences of prenatal obesity to the mother and to the baby? So some of the consequences of prenatal obesity include gestational diabetes, hypertension, a C-section, birth defects, fetal death, preterm delivery, a low birth weight, a high birth weight, delayed lactogenesis, and poor long-term outcomes. So what is the additional caloric requirement for the first trimester, for the second trimester, and for the third trimester? So for the first trimester, there actually is no additional caloric requirement. The first trimester is just a period of development. During the second trimester, it's around 340 calories, and during the third trimester, it's about 450 calories. So let's take a look at hunger and fatigue. So different nutrients are absorbed and released at different rates. And having a basic understanding of this principle can help women choose foods more strategically. Simple carbohydrates like sugar or juice are absorbed quickly and cause a rapid rise in blood sugar. And in general, complex carbohydrates are absorbed more slowly and cause a more gradual rise in blood sugar. The glycemic index, simply put, is a measure of how quickly a food causes our blood sugar levels to rise. And the measure ranks food on a scale of 0 to 100. So foods with a high glycemic index, or GI, are quickly digested and absorbed, and it causes a rapid rise in blood sugar. And the foods that rank high on the GI scale are often, but not always, high in processed carbs and sugars. So pretzels, for example, have a glycemic index of 83, and a baked potato measures up at around 98. Meanwhile, foods with a low GI are digested and absorbed at a slower rate and subsequently cause a slower rise in blood sugar levels. And these are typically rich in fiber, protein, and fat. And those three elements, fiber, protein, and fat, will actually help slow down the rise in blood sugar level. So, for example, an apple would have a glycemic index of about 28, Greek-style yogurt 11, and peanuts at around 7. So you can see there that the foods on the lower end of the glycemic index are going to cause a slower rise in blood sugar level. So after complex carbohydrates, proteins are digested even more slowly, and fats and fiber even slower than that. Again, these foods cause blood sugar to rise more slowly and steadily, and even fall steadily. So when blood sugar rises more slowly and falls more slowly, it actually leads to a feeling of satiety or satisfaction. And that's why if you have a meal primarily of refined carbohydrates, it will actually leave you feeling hungry more quickly. But a combination of protein, some fat, fiber, and carbs, a well-balanced meal or snack, that leads to feelings of longer fullness. Other substances can impact hunger as well. So caffeine and tobacco have been found to suppress appetite, while marijuana and alcohol actually stimulate the appetite. 3 well-balanced meals and 2 snacks consisting of a variety of foods is critical. Including complex carbohydrates, protein, fiber, and some fat will offer the best opportunity for women to really manage their hunger and manage their weight prenatally. So the consumption of more food to meet energy needs and the increased absorption and efficiency of nutrient utilization that occurs during pregnancy are generally adequate to meet the needs for most nutrients when good food choices are made. And now there are a few exceptions. Vitamin and mineral supplementation is generally routine, and it's even more important in vulnerable cases, such as those including food insecurity, alcohol abuse, tobacco, or other substance dependency. It's also important in cases of anemia, strict vegetarian or vegan diets, or when someone really just has poor eating habits. In general, pregnant women should seek medical consultation before taking a supplement that exceeds the tolerable upper limits for a particular vitamin or mineral, although women should inform their healthcare providers of all supplements taken. And again, we'll be looking at these in really specific ways. Many women consume less than the recommended amounts of calcium, magnesium, zinc, vitamin B6, and folate. And many new mothers are likely to have stopped taking their prenatal vitamins. If a nutritional deficit is suspected, prenatal supplements generally don't include a significant amount of calcium. In addition, during lactation, 250 to 350 milligrams of calcium is transferred daily from the mother to the baby through breast milk. So patients should be apprised of the need for additional supplementation to meet the requirement for this key mineral. And it's important to emphasize that vitamin and mineral supplements can't replace a healthy diet. It's also important to recognize that variety in a diet is important. Variety is what allows us to consume the full scope of vitamins, minerals, and nutrients. The bottom line, encourage your clients to aim for eating well and not perfectly. So now we're going to look at specific nutrients, starting off with folate. To prevent neural tube defects, all women of childbearing years should consume 400 micrograms per day of folate from fortified foods, like cereals and other grains, from supplements, or from both. Moreover, beginning 1 month before conception, pre-pregnant women should up their intake and consume folate from foods in a varied diet that reach around 500 micrograms a day. That is the ideal situation. Keep in mind that 50% of all American pregnancies are unplanned. You can see the increased levels recommended for pregnant and lactating women. The critical time for when the neural tube defect is occurring is prior to or just barely when a woman discovers she's pregnant. By then, supplementation is ineffective in offering protection against spina bifida or anencephaly. During pregnancy, demands for folate increases due to its role in nucleic acid synthesis. So what are good sources of folate? The major natural sources of dietary folate are legumes, green leafy veggies, liver, citrus fruits and juices, whole wheat bread. It's also available in nuts, beans, dairy products, poultry, and meat. It's also available in eggs, seafood, and grains. Spinach, liver, yeast, asparagus, and Brussels sprouts are also among foods with the highest levels of folate. So compared to the naturally occurring folate in foods, the synthetic form of folic acid, which is the form in a vitamin, contained in fortified foods and supplements, is almost twice as well absorbed. So keep in mind that your clients should be getting good sources of folate from natural sources as well as a supplement. So strict vegetarians and vegans are at greater risk than lacto-ovo-vegetarians and non-vegetarians of developing vitamin B12 deficiency, because natural food sources of vitamin B12 are limited to mostly animal foods. And a lacto-ovo-vegetarian is a vegetarian that does eat milk or cheese. So fortified breakfast cereals are one of the few sources of vitamin B12 from plants and can be used as a dietary source of vitamin B12 for strict vegetarians and vegans. Since vitamin B12 crosses the placenta during pregnancy and is present in breast milk, exclusively breastfed infants of women who consume no animal products may have very, very limited reserves of vitamin B12. They can develop vitamin B12 deficiency within months of birth. And undetected and untreated vitamin B12 deficiency in infants can result in severe and permanent neurological damage. The American Dietetic Association recommends supplemental vitamin B12 for vegans and lacto-ovo-vegetarians during both pregnancy and lactation, simply to ensure that enough vitamin B12 is transferred prenatally and via human milk. Pregnant and lactating women who follow strict vegetarian or vegan diets should really consult with a pediatrician regarding vitamin B12 supplements for their infants and their children. So the RDI for vitamin B12 for all non-pregnant, non-lactating women past the age of 14 is 2.4. For a pregnant woman, it's 2.6 micrograms per day, and for lactating women, it's 2.8 micrograms a day. So vitamin B12 is a water-soluble vitamin that is naturally present in some foods, added to others, and is available as a dietary supplement as well as a prescription medication. Vitamin B12 exists in several forms and contains the mineral cobalt. So compounds with vitamin B12 activity are called cobalamins. Vitamin B12 plays a role in making DNA, and it also helps keep nerve cells and red blood cells healthy. Vitamin D is essential for strong bones because it helps the body use calcium from the diet. Traditionally, vitamin D deficiency has been associated with rickets, a disease in which the bone tissue doesn't properly mineralize, leading to soft bones and skeletal deformities. Increasingly, research is revealing the importance of vitamin D in protecting against a host of additional health problems, such as increased risk of death from cardiovascular disease, cognitive impairment in older adults, severe asthma in children, and cancer. Research suggests that vitamin D could play a role in the prevention and treatment of a number of different conditions, including type 1 and type 2 diabetes, hypertension, glucose intolerance, and multiple sclerosis. It should be noted that the vitamin D RDAs are set on the basis of minimal sun exposure and are 600 international units per day across the board. Pregnant women at increased risk of vitamin D deficiency include those with little exposure to sunlight, those with vegan diets, and those with darker skin. Some consider a vitamin D deficiency to be a sunlight deficiency. In the case of vitamin D, low levels of vitamin D during pregnancy can result in the baby experiencing a deficiency as the baby's body accumulates vitamin D prenatally. Vitamin D and calcium deficiency can result in a number of different conditions and diseases. This is going to be a long list. You don't have to write these down, but lately research has been really exploring the role that vitamin D has in multiple, disease states and conditions. So vitamin D and calcium deficiency, for example, may result in all cancers, but specifically breast cancer, colorectal cancer, and prostate cancer. The deficiency can also play a role in cardiovascular diseases and hypertension. It can play a role in type 2 diabetes, metabolic syndrome, or obesity. It also has a role in immune responses in the area of asthma and other autoimmune diseases such as diabetes, inflammatory bowel and Crohn's disease, multiple sclerosis, rheumatoid arthritis, and systemic lupus. It also has a role to play in infectious diseases such as tuberculosis and influenza. Vitamin D is also being studied for its role in autism and cognitive function, as well as in depression and even physical performance. Vitamin D is commonly known for its role in skeletal health, in bone health. But again, the disorders and conditions that I mentioned previously, a lot of research is being undertaken right now to really explore vitamin D more completely, because as you can, tell from that list that I was sharing with you, that it has a role to play in many, many, many different disorders and conditions. Unless you count the sun, vitamin D is very limited in nature. Fortified foods provide most of the vitamin D in the American diet. For example, almost all of the U.S. milk supply is voluntarily fortified. Vitamin D is also found in fatty fish such as salmon, tuna, and mackerel, and these are some of the best sources. It's also found in beef liver, cheese, and egg yolks, but in a smaller quantity. And interestingly enough, mushrooms actually do provide some vitamin D. And in some mushrooms that are just coming out in the stores, the vitamin D content is actually being boosted by exposing these mushrooms to UV light. But that's just, again, a small, just a little side note. Almost all of the U.S. milk supply is fortified with 400 international units of vitamin D per quart. However, foods made from milk like cheese or ice cream, those usually aren't fortified. Now, vitamin D is added to many breakfast cereals and to certain brands of orange juice, yogurt, margarine, and soy beverages, but again, just check the label as well. And so it should be noted that the vitamin D RDAs are set on the basis of minimal sun exposure, and again, there's 600 international units across the board. And additionally, vitamin D is synthesized when UV sunlight hits your skin. Breast milk is low in vitamin K, and even breast milk from mothers who are taking vitamin K supplements is also low in vitamin K. Infants born in the U.S. are routinely given a vitamin K injection due to low infant stores at birth per the recommendation of the AAP. So only small amounts of vitamin K are transferred across the placenta during pregnancy. Without sufficient vitamin K, your blood simply doesn't clot, and infants can experience hemorrhagic disease, which is very rare but life-threatening. Vitamin K is known not only for its role in blood clotting, but it also influences bone health. There are two forms of the vitamin, one available primarily from leafy greens, and one that is synthesized in our GI systems from bacteria. So vitamin K is found in green leafy vegetables, such as spinach, kale, broccoli, and lettuce. It's also found in vegetable oils. It's found in some fruits, such as blueberries and figs, and it's also found in meat, cheese, eggs, and soybeans. During pregnancy, calcium is needed for the healthy development of a baby's teeth, bones, heart, nerves, and muscles. When a pregnant woman does not consume enough calcium, it is taken from her. It is taken from her bones for the baby. And it's important to consume adequate amounts of calcium daily before, during, and after pregnancy. Women between the age of 14 and 18 have additional requirements because they themselves are still increasing their own bone content. So as you can see, their requirements are 1,300 milligrams a day across the board, whether they're non-pregnant or pregnant or lactating, and 19 to 50-year-old women have a requirement, again, across the board of 1,000 milligrams a day. At least 3 daily servings of calcium-rich foods, such as low-fat or fat-free milk, yogurt, or cheese, or calcium-fortified plant-based beverages, cereals, and juices, is important. Just as a side note, a lactose intolerance and a milk allergy aren't the same thing. A lactose intolerance has to do with the body not having enough of the milk enzyme lactase to break down milk sugar, which is lactose, and this can lead to bloating, diarrhea, and other discomfort. For women with lactose intolerance, dairy products with less lactose, such as cheese, yogurt, or milk with added lactase, which is the enzyme that breaks down lactose, can be substituted for regular milk. And it is estimated that almost 25% of the U.S. population suffers from some degree of lactose intolerance. So, you will be coming across some clients with lactose intolerance. The intolerance is actually highly individualized. Some individuals can tolerate small amounts of lactose and others cannot tolerate it at all. So that's just something to keep in mind, that especially in this situation, no one is quite the same. Other popular milks, such as almond milk, may or may not have sufficient calcium depending on the fortification. So it is really important to read the labels. In terms of the milk allergy, a milk allergy has to do with another macronutrient entirely, the milk protein. Again, lactose intolerance concerns the milk sugar, whereas the milk allergy is concerned with the protein. Women with a milk allergy would not be able to consume most of the products intended for lactose intolerance because most of them still contain the milk protein that actually draws the allergic response. During pregnancy, calcium enjoys special prenatal absorption. There's increased intestinal absorption during pregnancy, and ingesting vitamin D along with a calcium supplement actually assists with maximum absorption and use. So most of the time, calcium supplements, as well as vitamin D supplements, are recommended. But for pregnant women who don't consume milk products, for example, due to a milk allergy or another reason, a calcium and vitamin D supplement would be especially recommended. And there is a table in your text that lists all sources of calcium, including which are the best calcium supplements to include. To improve absorption, one thing to remember is that calcium supplements can be divided into 2 or 3 doses and taken with meals. So good sources of calcium? Well, calcium is found in milk, yogurt, and cheese. And these are the main food sources of calcium for the majority of people in the United States. Kale, broccoli, and Chinese cabbage are adequate vegetable sources of calcium. And although spinach may have calcium, that calcium is really poorly absorbed. Fish with small bones that can be eaten, such as canned sardines, canned salmon, those are decent animal sources of calcium as well. So most grains, such as breads, pastas, and unfortified cereals, while they're not rich in calcium, they do add significant amounts of calcium to the diet simply because people eat them often or in really large amounts. Calcium is added to some breakfast cereals. It's also added to fruit juices and other soy and rice beverages, as well as tofu. Again, read the labels to find out which foods have a good source of calcium. Iodine is a vital component of two different thyroid hormones, and the mother's thyroid hormone levels do affect proper fetal growth and neurological development during pregnancy and after birth. And lately, we have seen some instances of an iodine deficiency. Iodine also has a role in metabolism, protein synthesis, enzymatic activity, and it also plays a role in fetal and infant skeletal and central nervous system development. The Institute of Medicine has set the RDA for iodine before pregnancy at 150 micrograms per day. During pregnancy, it bumps up to 220, and during breastfeeding, it jumps up to 290 per day. Because the diet of a pregnant or breastfeeding woman may not contain enough iodine, the American Thyroid Association and the American Academy of Pediatrics recommend that pregnant or breastfeeding women take a daily multivitamin or prenatal supplement every day containing 150 micrograms of iodine. Not all multivitamin prenatal supplements contain 150 micrograms of iodine. Therefore, advise women to check the nutrition label or have them speak with their healthcare provider about whether their multivitamin supplement or prenatal vitamin contains enough iodine. The DRIs for iron reflect a non-prenatal woman's need for additional iron due to the demands of menstruation, as well as for pregnancy and lactation. I included the male requirement for iron to demonstrate the difference because even as men have, generally speaking, increased muscle mass, their requirements are still lower. The Institute of Medicine notes that because the median intake of dietary iron by pregnant women is well below the EAR, pregnant women should have additional supplementation. As well, iron deficiency anemia is the most common nutrient deficiency found in the U.S. The Dietary Guidelines for Americans advises that women who are pregnant take an iron supplement when recommended by their OB or other healthcare provider. It adds that low intakes of iron are a public health concern for pregnant women. The ACOG recommended testing to determine whether supplementation is necessary. Healthy, non-anemic prenatal women surrender their iron via the placenta. They also store adequate iron stores to provide their baby via human milk with sufficient iron for the first several months, again, if they are healthy and non-anemic. And we will talk more specifically about this during the next module, Nutrition During Lactation. As you can see, through age 14 through 18, for a male, the amount of iron is only 11 milligrams a day. For a female, non-pregnant, non-lactating, it's 15 milligrams a day. For pregnancy, it jumps way up to 27 milligrams a day, and it drops back down to, during lactation, 10 milligrams a day. From 19 through 50, as you can see for men, the requirement is 8 milligrams a day. For women, it jumps up to 18 milligrams a day, non-pregnant, non-lactating. And for a pregnant 19 to 50-year-old, that remains constant at 27 milligrams a day. For a lactating woman who is 19 to 50, the requirement is 9 milligrams a day. Iron is a mineral that the body needs for growth and development. Your body uses iron to make hemoglobin, a protein in red blood cells that carries oxygen from the lungs to all parts of the body, as well as myoglobin, a protein that provides oxygen to muscles. Your body also needs iron to make some hormones and connective tissue. Prenatally, iron is crucial for supporting the growing baby, the placenta, and the red cell mass. Maternal iron deficiency is the most common nutritional deficiency during pregnancy. Pregnant women need at least 27 milligrams of iron each day, which is double the RDI of pre-pregnant or lactating women. Iron deficiency during pregnancy increases the risk of maternal and infant mortality, premature birth, and low birth weight. Of additional concern is that prenatal and breastfeeding women may already be tired, and low levels of iron can affect the oxygen carrying capability of the blood. This would result in additional fatigue above and beyond what they are already experiencing. An anemic woman is susceptible to possible blood loss or surgical risk. Low intakes also increase her infant's risk of low birth weight, premature birth, low iron stores, and impaired cognitive and behavioral development. So animal sources of iron include meat, chicken, fish, pork, turkey, and eggs. And the iron that's found in animal products, that's heme iron, and that's actually more easily absorbed than the iron that is from the plant sources, which is less easily absorbed. Plant sources of non-heme iron include beans, fortified cereal and bread, spinach, and nuts and dried fruit. For vegetarians and women who don't eat a lot of meat, increasing iron absorption by combining plant-based sources of iron with vitamin C rich foods is suggested. For example, spinach salad with mandarin oranges or cereal with strawberries. The iron from spinach and the vitamin C from the mandarin oranges. Cereal would have the iron and strawberries would have the vitamin C. And again, it's that combination of the vitamin C with the iron that enhances absorption. Also, heme iron from any source in combination with a non-heme plant source of iron also helps iron absorption as well. It should be noted that calcium interferes with iron absorption, and likewise iron interferes with calcium absorption. Iron deficiency anemia is most common in populations with low socioeconomic status, multiple gestations, and limited education. One additional note about iron, for iron supplementation when recommended, tolerance may be difficult for some women due to heartburn, nausea, constipation, and diarrhea. And so to ease discomfort, it could be suggested that women take these tablets at night prior to bed so that they can sleep through the discomfort, or they can take it with juice or water. Iron supplements should not be taken with milk as absorption is decreased. Additional suggestions about adequate or additional fiber may be needed if women are struggling with constipation because of the iron supplementation. This concludes the Nutrition During Pregnancy module, Part 2.